Anxiety disorders, first of all, are syndromes in which anxiety becomes very disruptive to a person's life in different ways. And there's the three main ones are social phobia. The second one is obsessive compulsive disorder. And the third one is generalized anxiety disorder. And these are all the time misdiagnosed. They're mixed up with each other. Social phobia is the most common, and it can start as early as 2 years old. And they've done studies where they see that some baby is anxious. It interferes with bonding with the mother. But more often than not, it's usually there by age 18. And many kids have it before they go to grade school. And so what is social phobia? Social phobia is being uncomfortable around other people or in places that you're not familiar with. And it is a terribly destructive type of anxiety because it affects if you're around people you don't know or new places you haven't been, so people become very introverted. And if you're shy, most likely you have social phobia. And it can be so severe you can't function, or it can be fairly mild, so it varies quite a bit. And it's we kind of know what causes that, actually. I mean, the brain, it's again caused by a gene that you inherit from your ancestors. And it has tentacles that can go out into so many parts of your life that it can be totally disruptive. But it's also easy to treat if you make the right diagnosis. But many times it's made incorrectly. A lot of people with social phobia, when seen as adults, are told they have generalized anxiety disorder. They don't. Generalized anxiety disorder is more commonly seen among women in their mid-50s. And it comes on later in life, which is unusual because most psychiatric problems come on a lot earlier. And generalized means that it's just kind of there all the time. One of the other diagnoses, which I mentioned, was obsessive compulsive disorder.
Right.
And that can start as early as age 3 or 4. I've seen adult patients where it started at age 3. They were totally obsessed with one thing or another. They had compulsions, totally destroyed their life. At least they couldn't. They sought treatment, the parents sought treatment, but it was very, very difficult. And people with OCD worry about everything. And they have a very specific type of obsession. Obsession is continual thinking about something. And they have frequently what are called fear of harm obsessions. And you can see these in children aged 5 or 6. They're obsessed with the fear that their parents are going to die suddenly. Or if they're like a mother of childbearing age and they have a young baby, they worry about their kids suffering catastrophic problems like being run over by a car. Some of them actually have visual images of this. Seeing their 3-year-old child being molested, have their throat cut, just the most ghastly things, because there's nothing that's going to happen, but this is some of the symptoms they have. And a kind of a way of bringing this to a more understandable thing. Let's say a mother has a 4-year-old that's in daycare, and her TV's on, and she walks in the living room and she hears almost out of the left side of her ear that the daycare child has been kidnapped. Maybe in Australia somewhere, but it doesn't matter. Their anxiety just goes up through the roof. And they can't rest until they lay their eyes on that child. It's a very disturbing disorder to have. I think OCD is one of the hardest things to treat in all of psychiatry. I've treated a lot of it, but there's not a lot of options. So generalized anxiety is, I just wonder if that's really OCD that didn't get diagnosed, because it's there all the time, and that's the way OCD is. OCD anxiety is like a wave. It goes through the day. It goes up and down. It never goes away hardly ever. And it's hard to treat because there aren't many medicines that work. Now, these are all genetically determined. So OCD has an incidence of about 4% in the general population. Social phobia is around close to 20%. So that's 1 out of 5 people. That's a lot of people. Out of, say, And the kids are vulnerable to it, so maybe out of 270 million people, 20%. What is that? 10, 20? That's 54 million people. You talk about a lot of people, that's a lot of people. OCD is about 4 or 5%, like I said. Generalized anxiety, I really can't tell you exactly, but it's nothing like 20% or anything. And these are all caused by genes that screw up, that turn on the brain in incorrect ways.